That's my name. You can see my affiliations. I serve the International Society as Executive Director. I also run a consultancy firm out of Geneva. This is what I intend to talk about, share some thoughts about priority digital health action areas from WHO, and basically make a case for scaling up of digital health interventions, and we'll get to that. 11 years ago, when the World Health Assembly, the annual meeting of health authorities around the world, passed a resolution on e-health, we were asked, I was at WHO at the time, responsible for worldwide e-health at the WHO headquarters. We're asked to identify, since WHO couldn't do everything that needed to be done in the area of digital health, what were the priority action areas that the organization needed to engage to support countries. We came up with 4 priority action areas and 4 enabling actions. They had to do with the workforce, public health, education for the public, e-learning, developing the health workforce, providing health services, and health information systems, the brains of the health system, if you will. As enabling actions, it was found necessary to look into the regulatory environment in which ICTs are applied to solve health problems. We needed also to look at norms and standards. We wanted to look at public-private partnerships for ICT R&D to support health development. And finally, for e-health business intelligence through something we call the Global Observatory for e-health. 11 years on, some of these areas are still of great value in the digital health space, and progress has been made, but we still have a number of challenges to face. And I'd like to share with you some of these challenges. But first, this is what the digital health space looks like. That first bit simply says that ICT is the 3rd pillar of the health industry. The first was based on chemistry, led to the pharmaceuticals industry in the 19th century. In the 20th century, physics gave us imaging systems. That was 2nd pillar. In the 21st century, ICT, the foundation of knowledge-based systems, is the 3rd pillar for health. And this is one organization's view of the digital health space. We all could have our own views about that. The point is, it is broad, it is varied, there are intersections, and there are many things to consider, all of which involve the application of ICT in health. As you can see, whether it's consulting, patients consulting their physicians, either directly or online, they're all aspects of the digital health space. There. What are some of the challenges? A few years ago, we published a paper outlining 6, what we call the 6 digital health grand challenges. The first, and the grandest of them all, in my opinion, is the idea of knowledge sharing. There's a lot of repetition, there's a lot of reinventing the wheel in digital health, primarily because there's no single place you can go to, or any set of sources that one could go to find out what has been done when one wants to start a project. And so people wind up recreating, redeveloping systems that already exist. That's the first grand challenge, and I'll have an occasion to come back to it if I have time. The second is going to scale with digital health interventions commensurate with the size of the problems that we're dealing with. It's not particularly useful applying a small-scale solution to a huge problem. The third is creating integrated e-health systems that talk to one another. And in fact, over the past few years at the World Health Assembly, resolutions have been passed on interoperability of health system components. The fourth is the need to capacitate, is a term that's used in some countries, to enable everyone in the health sector to leverage the power of information and communication technology. There is no single activity in the or single profession in the health space that cannot benefit from judicious use of information and communication technology. So transforming all health workers into e-practitioners is another major challenge. The fifth one is to support health production. By that, I refer to the fact that much of what is done currently in digital health is focused, I would say, on digital medicine, on the curative aspects of health. But when you look at what produces health, cure is a small sliver of what actually produces health. Some of the more basic aspects are water and sanitation, housing and shelter, food and nutrition, education, and of course then there's healthcare. The pathways to good health are more numerous in these other areas than strictly through curative interventions. And I think we need to explore more fully how ICT can help develop health as opposed to simply waiting for people to fall sick and then we do our best to heal them. The sixth grand challenge is that, like any physical system, health systems are always lagging behind. Today's interventions are in response to the problems we identified yesterday and will not take effect until tomorrow. So in order to avoid the problem of this lag, we need to anticipate where the health system is going and what ICT interventions are going to be necessary to address the problems that we'll encounter in the future. But for today, I'd like to focus primarily on grand challenge number 2, going to scale with interventions that are appropriate to the size of the problems that we face. What do we scale? 2 basic problems. What do we scale? That evokes the idea of evidence. We must have evidence that what we're going to scale works, under what conditions it works, and how to translate that to different contexts, to different related problems. We must also know how to scale. Perhaps that's just as big a problem as developing the evidence of e-health interventions. And so this graphic comes from some work that we've done in the area of addressing grand challenge number 1, which is the global knowledge commons for e-health. A resource that can tell you who is doing what, where, how well is it working, what lessons can we learn from it, and what reusable objects have come from that effort. Scale limitations, of course, the most classic of all of these is being able to transfer information from one part of the health system to another. We talk about a continuum of care, following a patient throughout their journey, from one part of the health system to another, whether it be from an inpatient service to the outpatient service to outreach, et cetera, and having their information seamlessly follow them through that. So when you do things on a small scale, it's quite easy to be successful. But when you need to scale them up, you run into problems of interoperability of these various systems that you face. And failures in small scale activities or activities that fail to scale result in what I might liken to building resistance among beneficiaries, among practitioners to the use of ICT in the health sector. Much like with TB, we have drug resistance TB, multiple drug resistance TB, and so on. Frameworks have been developed in the past to help us scale M and E health interventions. I'll just refer to 3 of them in this talk. One of them is a model by a group called the Advanced Development for Africa. They published a guide in 2011, I believe, 2011, yes, a guide on how to scale up. Basically, their approach was to think of an integrated system and all the requirements of what it would take to go from a small scale to a large scale mHealth intervention. The second framework was one published by the Partnership for Maternal, Newborn and Child Health, PMNCH, a WHO partnership, and its purpose was to identify obstacles to scaling up. And once you identify the obstacles, they then provided a guide on how to do that. The guide itself identified 12 areas of mHealth interventions and 9 themes that were important to cover when you wish to do the scaling up. The third framework that could be very useful for this purpose is one that was published by the International Telecommunications Union, based on work actually that was done here in India, and identifies a number of steps that need to be followed if you want to scale up an mHealth or eHealth project. So these are some of the tools that are available to help us do scaling up. Let me just motivate some of the reasons for scaling up and some of the challenges that we face. One of them is what I call regulatory interoperability. It's been evoked this morning, the idea that beneficiaries should be able to enjoy or continue to receive services wherever they go physically from one jurisdiction to another. Yet, if you wanted to have that possible, you must have cross-jurisdictional agreements on services. For example, providing medical advice in another jurisdiction from one jurisdiction, providing medical service in a jurisdiction outside of where you are. This chart simply says the following. If you take all 194 member states of WHO, assuming you want to travel all around them and still enjoy that, to be able to do agreements on a partial basis, you would need a large number of bilateral agreements. If you wanted a trilateral arrangement, you need an even larger number, over 1 million of them. But all of this can be obviated by having a single global compact on eHealth. And some years ago, we did some work on this, and it's analogous to something like the International Health Regulations 2005, where all countries agree to certain rules and regulations, certain activities in the area, in this case, of digital health. It is possible, it can be done. My thesis is that in the first decade, now a decade and a half of the 21st century, we've made significant advances in digital health, but there's still a lot more to be done, and 2 of the key areas where work needs to be done is, one, in sharing what we know. I believe, for example, that if you looked around this room, just this room alone, and if each of us knew what everyone else in the room knew, there are very few problems that we would not be able to solve. But unfortunately, everybody has their set of knowledge, and even though the set together can solve all our problems, each person only has access to what they know. So if we can create a knowledge commons which puts together our collective wisdom, I think there's a lot to be done for that. And the second challenge then, as I said, is how to scale up from small-scale projects to major projects. So to conclude, given the fact that our health is a product of everything that we do, the Commission on Social Determinants of Health has said clearly that your health is a function of everything that you do, where you live, where you work, where you play, eventually where people die. We need to integrate all of these activities. And so the idea is not just ICT for health, but ICT for development, because other development activities influence one's health. And our strategy then should be to create pull forces in countries which enable them to integrate and build capacity for this. So that's what I have for you today. I thank you for your attention.